Prediabetes is when your blood sugar level is higher than normal, but not high enough for your doctors to diagnose diabetes. The average blood sugar level is up to 140 mg/dl after 2 hours of eating. If the value ranges between 141 to 199 mg per deciliter, after a glucose tolerance test, the person is considered pre-diabetic. Pre-diabetic people are at a higher risk of developing type 2 diabetes later in their lives. According to one study, it is estimated that there are a total of 88 million pre-diabetic people over the age of 20 in the United States, and around 90% are unaware of their pre-diabetic status. Therefore, it is worth keeping an eye out for pre-diabetic warning signs. Unlike type 2 diabetes, we can reverse pre-diabetic symptoms, which result in far fewer health consequences, higher quality of life, and longer life expectancy. In today's video, we will discuss 6 warning signs of prediabetes, and we will also discuss 6 steps that you can take to reverse prediabetes. Number 1. Increase hunger. When our digestive system breaks our food into glucose, it gets into the bloodstream, and this sugar is used by our cells as a fuel. If the person is insulin resistant, the glucose is trapped in the bloodstream and never makes it to the cells. Regardless of how recently the patient ate, the cells feel deprived of energy. As a result, the cells trigger the brain to crave more food. Excessive hunger is a classic warning sign of prediabetes. Unfortunately, excessive eating results in increasing the weight of a person, and the blood sugar spikes even higher, causing further problems and progressing toward type 2 diabetes. Number 2. Frequent urination. When the body does not absorb glucose, the kidneys try to absorb it when the blood is passed through them during the filtration process. If the kidneys can't keep up with the excess blood sugar, they will pass it into the bladder, so your body can excrete excess glucose as urine. The need to urinate more frequently than usual is a warning sign of prediabetes. Frequent urination is defined as the need to urinate 7 or more times within 24 hours, having consumed 2 liters of water within that 24 hours time period. Number 3. Increased thirst. In an attempt to flush out the excess sugar from the bladder, the body diverts water into the urine. This leaves the body with insufficient water to perform the many functions that the water facilitates, resulting in dehydration. If the prediabetic person attempts to quench their thirst with juice, soda, or other sugary beverages, they may worsen their condition. The sugar in these drinks further increases the blood sugar levels, resulting in more urination without hydration to replace the lost fluids. Number 4. Feeling tired all the time. Another warning sign of prediabetes is feeling tired all the time. When glucose does not reach the cells due to lack of insulin or insulin resistance, the cells are not getting the fuel they need to function. The fatigue may be accompanied by headaches, irritability, trouble concentration, sore reflexes, and loss of motivation. Fatigue or apathy can be of particular concern since the patient may not have the energy to exercise, one of the key factors in reversing prediabetes. Number 5. Tingling in your hands or feet. The high blood sugar level in prediabetes can damage your nerves. The clearest sign of diabetic neuropathy is burning, tingling, or nut sensation in the fingers and the toes. If the condition advances, diabetic neuropathy may lead to foot ulcers and require amputation of the foot in extreme cases. Tingling fingers and toes is a warning sign of prediabetes. By identifying this condition, you can take the necessary steps before it gets worse and reverse the course of diabetes. Want to know more about how to prevent nerve damage? Check out our video on vitamins that hinder nerve damage. Number 6. Blurred vision. High blood sugar also causes the eyes and the tissue around them to swell and rupture the capillaries and small blood vessels in the eyes. This distorts the shape of the eye lens and makes it impossible or difficult to focus properly. This results in blurred vision even if the patients wear glasses or contact lenses. If this condition is left unchecked, it can progress to detachment of the retina and ultimate blindness, especially in patients with type 2 diabetes. So viewers, these are the 6 early warning signs that may indicate that you have prediabetes. Now we will discuss 6 steps that you can take to prevent the progression of prediabetes into diabetes. According to one study, losing even just 5 to 7% of your body weight significantly reduces the risk of type 2 diabetes. Aim for physical activity at least 150 minutes per week or about 30 minutes daily for 5 days per week. Limit your sugar intake and avoid soda, sweet tea, and sports drinks. Manage your stress with meditation and other stress reduction techniques. Eat more fiber-rich food such as fruits, non-starchy vegetables, whole grains, and nuts. If you smoke, consider quitting it. Remember, this video is for educational purpose only. We are not giving you medical advice, and so you should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then like this video, subscribe to our channel, and hit the bell notification button to view more upcoming Create Cure content like this.